Welcome to Comply on the Fly with M3 and Karen B, your trusted resource for quick, reliable insights into employee benefits compliance. Each episode delivers clear answers to common compliance questions. Whether you're tuning in for the first time or you're a seasoned listener, we're here every other week to make navigating compliance a little easier. Please note this podcast and the contents herein do not constitute legal advice. In all cases, employers should consult with their own legal counsel. Let's dive in.
Hello, everyone. I'm Karen B, and the Comply on the Fly topic for today is a big one: mental health parity. The mental health parity requirements are not new. The Mental Health Parity and Addiction Equity Act, or MHPAEA, was enacted in 2008. However, regulations and rules have been issued on several occasions since that time, most recently on September 9th, 2024. These final rules address many requirements, but today I want to highlight the requirement that impacts employer plan sponsors the most, and that is the comparative analysis requirement. As a reminder, the whole purpose of MHPAEA is to ensure that mental health and substance use disorder benefits in a group health plan are not subject to less favorable limitations than those imposed on medical and surgical benefits. The requirement applies to both quantitative treatment limitations, or QTLs, which we be numerical and easy to compare, such as visit limits, and non-quantitative treatment limitations, or NQTLs, which are non-numerical requirements that limit the scope or duration of benefits, things like prior authorizations and medical management policies. For purposes of this podcast, I want to focus on the comparative analysis requirement for NQTLs. Again, the NQTL analysis requirement is not new. The requirement was included in the Consolidated Appropriations Act, or CAA, of 2021, which amended MHPAEA. However, the recent final rule formalizes the content requirements for the required comparative analysis that must be completed and provided to the Department of Labor upon request. For plan years beginning January 1, 2025, the NQTL comparative analysis must include the following: descriptions of each NQTL and which mental health substance use disorders are subject to the NQTL, identification and definition of the factors and evidentiary standards used to design or apply the NQTL, description of how factors are used in the design and application of the NQTL, demonstration of comparability and stringency as written, demonstration of comparability and stringency in operation, and findings and conclusions regarding the plan's compliance with MHPAEA. You probably just listened to that list and think to yourself that you have no idea how to obtain that information. Well, it will depend on whether you are fully insured or self-funded for medical. If you are fully insured, this analysis should be done by your carrier, as the requirement is applicable to issuers of group health plans, which are carriers. However, if you are self-funded for medical, this will be an exercise in finding out if your third-party administrator, TPA, and PBM, pharmacy benefit manager, if you carve out prescription drugs, is willing to do the analysis for you. If not, you will have to either create the analysis by using the DOL's self-assessment tool, which can be found on the DOL.gov website by typing in MHPAEA self-assessment tool, or contracting with a vendor, or retaining the services of a law firm. And for ERISA plan sponsors, which are non-governmental private sector employers, the comparative analysis must contain a certification by one or more plan fiduciaries that they engaged in a prudent process to select a qualified service provider to perform and document the comparative analysis, and that the duty to monitor that service provider has been satisfied. Please note that the DOL can request the comparative analysis at any time, and if requested, it must be produced within 10 days of the request. Failure to comply can result in enforcement action, which may include notifying plan participants of noncompliance, reprocessing claims, or monetary penalties. Plan participants can also request the comparative analysis, and it must be produced within 30 days of request. With such short turnaround times to produce the comparative analysis, Many self-funded medical plan sponsors are proactively engaging with vendors to have the analysis on hand. And fully insured plan sponsors are confirming with carriers that the analysis will be done and available. If you need more information on the NQTL comparative analysis requirement or available solutions, please contact your M3 team. And that is your Comply on the Fly topic for today. Thanks for tuning in.
For more employee benefits compliance insights from Karen B. and her team, please visit m3ins.com.